Hi, I'm Ed Clark, President of the Wildlife Center of Virginia. The Wildlife Center of Virginia is a teaching and research hospital for wildlife medicine, conservation medicine. We take students from every vet school in the U.S. and Canada and from more than 40 countries around the world who come to work with our world-class staff to learn to use their general veterinary skills in the very specialized world of veterinary medicine for wildlife and conservation medicine for the environment. Back in 1985, when we had our first bald eagle brought in as a patient, it came in on a Friday afternoon in the month of March, and we could tell pretty quickly he had been poisoned. What we didn't know was what was the poisoning? How did he get that poison, and did that present a threat to other wildlife still in the environment? Working with our state wildlife biologists, we went back, interviewed the farmer in whose field this bird had been found, and quickly identified the chemical. It was a granular insecticide, and when we checked into that, we found that not only was this bald eagle at risk, according to EPA's own estimates, as many as 2 million birds a year were being killed when farmers used this chemical according to the label directions. That was simply unacceptable. So it took us a while, but using that one bird's case study, we were able to illustrate the unacceptable environmental risk presented by this pesticide, and eventually it was banned, not only for use in the United States, but banned for use in any country that wants to export goods to the United States. More recently, we've done a study of the eastern box turtle. We found that a large number were coming in with chronic ear infections, sinus infections. Their heads were so swollen sometimes they couldn't even pull them back into their shells. As we investigated the cause, we found that it was the chronic exposure to organochlorine pesticides causing these turtles to have these infectious issues. One of the real implications that was startling for all of us is that in humans, there's a similar epidemic of sinus and ear infections in preschool children. And we believe, and we have shown, that it could be chronic exposure to those same pesticides causing a problem for human health and safety. One of the things that distinguishes the Wildlife Center from so many other organizations is we actually build a relationship with our donors and supporters. If you want to get to know the staff, if you want to get to know our patients, we make it easy. Go to our website. You can see streaming video of the patients that are undergoing care and that are recovering from the wide range of problems that they confront in the environment. One of the things that makes it really educational for the public is that we have a live discussion group that goes on almost all day where people can ask questions about what they're seeing or get information about environmental or wildlife-related issues in which they have an interest. If you want to help the Wildlife Center, it's important for you to know that we never take your help for granted. We're large enough where we can make a difference worldwide, but we're small enough where every gift makes a difference for us. We never forget that the money you send to our organization is not our money. It's still your money. You've just entrusted it to us to do something worthwhile that will make the world a better place for wildlife and humans.